going to be about Resolve New England, which is a nonprofit organization serving the infertility community in the New England area. And this evening from Resolve New England, we have Kate Weldon and Kirsten DeSorbo here with us, and I will turn it over to them and have them get started.
Thank you, Sam.
You're welcome.
So, hello, everybody. It's nice to see you virtually, see some of you and see your names. This is a great response, and we're really happy about that. And I'm going to share my screen. And while I do that, I'll say that we really do welcome your questions. We absolutely want you to jump in with questions. So the best way to do that is to enter it in the chat. So, and our friends from the Junior League will be helping us keep track of those questions. So let me share my screen. All right, can you guys see that? Okay, great. Hopefully. Okay. All right, great. Sorry, it seems like there's like a delay. So, as Sam said, we are from Resolve New England, and I will just share a little bit about who I am and then pass it over to my wonderful Kirsten so she can do the same. So, I'm the executive director of Resolve New England, and I have been since January of 2015. And I absolutely love our work and our organization. My husband and I went through years of infertility ourselves and really wanted to be parents more than really anything in the world. So it was a very challenging time when we were struggling to achieve it. And we are fortunate. We were in Massachusetts while we were going through infertility, and Massachusetts has one of the best and longest fertility insurance laws in the whole country. So as hard as the experience was, we were fortunate to be in Massachusetts, and we were fortunate to have some great emotional support from friends and family. And so that made a difficult experience a little bit better. And so when Resolve New England was looking for an executive director, I just absolutely wanted this job because I care about a lot of things, like I'm sure all of you on the call. We have so many kind of issues and causes that are close to our heart, but to me, nothing is closer than all the people struggling so hard to become parents. And we are parents. My husband and I have a daughter from IVF who is now 13 and taller than me. So it's crazy to think of those days when we were really in the thick of trying. And we wanted more than one child, ideally, when we first, started to want to grow our family, and that hasn't happened. But we just are very, very grateful to be parents. And it kind of taught us that it may not be the family you envisioned, but it is a family, obviously, that you're very happy to have. So that's a little bit about me. And professionally, I've always worked in nonprofit management and government advocacy, which is very relevant to our mission. So Kirsten?
Yes, thanks, Kate. So welcome, everybody. I'm really glad to be here with you all tonight. I'm Kirsten, and I just, not to embarrass you, the other Kirsten that I saw, but I saw another Kirsten, and I was like, oh my God, that's so cool.
Put her on the spot.
I know, I'm so putting you on the spot, and I don't mean to, but yeah, it's so funny. So, but anyway, yeah, so I have been with Resolve New England for almost 7 years now. And so I started actually before Kate, and then was so lucky to then have her take the lead as executive director. And it's just a great organization, and I love working here. And I started out as a group attendee, a Resolve New England group. My husband and I went through secondary infertility, and that is when you have a child, biological child, and then you struggle to conceive, carry to term another child. So we had our daughter, and then about a couple years later, we tried to have another child and experienced 4 unexplained losses. And it was, oh, yeah, just tough times. It still like brings like a knot to my stomach even when I like talk about it. But I don't like to say that we were lucky enough. I think it just kind of happened that the 5th pregnancy just happened to, I was able to carry to term. I didn't do anything different, nothing that's totally unexplained. And she's now my 7-year-old daughter. So I have a 12-year-old and a 7-year-old. And the experience, I feel like it's changed me in a lot of ways, but one of the very concrete ways is when I do meet someone at a playground, at school, and they have a child, I never say, oh, just one? Oh, is that your only child? I try to say something different, and because, you don't really think about it, but there's judgment in that. It sounds kind of judgy. And, this experience of going through secondary infertility when you so badly want something, but you don't know how to fix it, and you would if you could. So it's just, it definitely changed my life, at least in that respect, and how I look at other families and what other couples, you just never know what other couples are going through. So yeah, I'm the assistant director, and yeah, it's just, again, a pleasure to be here with you all. We had a great presentation last year. We were in person. We were just talking about that. I can't believe that was a year ago, but it's great to see you all again.
Exactly. So as we mentioned, I hope, can you hear me okay? I'm getting an echo on my end, but could be me.
Yeah, no, you sound fine, Kate.
Okay. So we are a nonprofit organization, as Sam mentioned, and we are dedicated to building a caring community within New England to support, inform, and advocate for all those that are struggling with fertility and family building. And this is one of our little success babies here, wearing one of our Worth the Wait onesies. This little girl was a long time coming for her. She has 2 mamas, and they tried for a long time to have her. So we definitely celebrate whatever the resolution of family building looks like for all different families in New England. We are an independent nonprofit that is focused just on New England. There is a National Resolve Association, and we partner with them as well, but we are our own separate entity. So. And as Sam mentioned, really the 3 pillars of our mission are education, support, and advocacy. And so that takes various forms. We always are trying to share content and information in an unbiased way that helps people make informed decisions about their family building. And emotional support is really the cornerstone of our mission. As Kirsten mentioned, we have a whole network of peer support groups. Of course, they're meeting virtually right now, and we will always have a virtual support component so that anyone from New England, even if they don't live near an in-person group, will be able to connect with each other. But typically, when there is not a pandemic, we have in-person peer support groups all over New England, and they are for a variety of issues, including trying to conceive for the first time or secondary infertility, as Kirsten mentioned, pregnancy loss, donor conception, adoption, all different parts of the family building journey. And then advocacy, as I mentioned, that's what my background is in. My first, over a decade of my first part of my career was working in government and public policy. And So that's really an important part of our mission. And particularly, we work on a lot of issues, but particularly, unfortunately, access to fertility treatment across the whole country is very inadequate. There's only 19 states in the whole nation that have a fertility insurance law of any kind. Fortunately, 4 of the 19 are in New England. So in New England, only Maine and Vermont do not have one. But even some of the states that have one, they could definitely be better and be updated. So advocacy really will always be part of our mission, because I'm sure there'll never be a day where it doesn't need tweaking of some kind. So, and I just wanted to share that our conference, we have been offering a family building and fertility conference for, this would be our 27th year, which is pretty amazing in and of itself. But again, of course, because it's 2020, this year our conference will be virtual. And like anything and so much this year, we're feeling the loss of that experience of being together in person. But we also are trying to embrace the silver lining of the fact that it's going to be more accessible, more affordable. Much like tonight, you can be like cozy in your own home and participate in the conference. So I'm actually really hopeful about the fact that we're going to reach more people who need our information. They will, at our conference in person and now virtually as well, you have the opportunity to connect with exhibitors that are professionals all across the family building field on a one-on-one basis, which is a really great opportunity. And so we'll still be doing that. It'll just be in these virtual booths that Kirsten and I are learning every day more and more how to do. So anything you want to add about the conference, Kirsten?
I mean, I love what you said about it just being able to reach more people. You don't have to drive somewhere, stay overnight, or, and again, because we do serve the New England region, as we all know, the top of Maine to, the bottom of Massachusetts is far. So, I think that is really, like you said, the kind of bright spot here is that hopefully we're going to reach more people geographically as well as economically.
Yeah, I agree. So of course, Kirsten, we planned in advance who was doing what slide, and now I completely forget what is what.
Oh, so no, it's fine. It's fine.
Jump in if I was like, oh, I totally don't remember.
No. So I think you've got these
I'm going to talk about this
yeah.
one. Yeah. So that was a little bit about Resolve New England. And again, if you have any questions about our organization or about our own personal stories, feel free to put them in the chat. So that we wanted to share a little bit about who we are as an organization and who we are as individuals. But we also wanted to give you just a very quick overview about reproductive health. We will say right on out there, Kirsten and I are not medical professionals. We have, unfortunately, a lot of on-the-job training from our own experiences, but we are not physicians. But we did want to share just a little bit of basic information around reproductive health, because personally and as an organization, we are really committed to trying to be part of the solution in terms of, I think, reproductive health education not being what it should be. And we feel that information is power, of course, and that sometimes we feel that it's inadequate what we learn about our own fertility and our own reproductive and sexual health at a young age. We don't learn enough. And I know for me personally, I feel like I didn't really know as much as I should have known until I was having problems with my fertility. And in an ideal world, I want it to be proactive. So, as I think some people do know, there is a gradual loss of fertility as part of the normal female aging process, and that does become more dramatic after the age of 35, and that's particularly around egg health. So I think it's important for people to know that, but I also, of course, want to stress that, because that's always the balance. Like I said, I feel like information is power, but I also don't want to do anything that really adds more pressure and stress to the feeling that, there's like this literally ticking clock in your ear around your own fertility. There's wide variation in general. It absolutely is true. It's unfortunately that there is just literally a loss of egg health and egg quantity as you age, but there is no guarantee that you will or will not struggle with fertility based on age. As I'm sure you know from your own experience, there's people who have struggles when they're trying at a really young age, and there's people who don't struggle at all when they try to conceive at 40. So there's no guarantee. Again, I think it can be empowering to do some fertility testing when you're younger, even if you don't want to conceive right now, or even in the foreseeable future. But there are some basic tests that you can have that just kind of give you a little bit of a sense of whether you may face challenges in the future, and that can really help your decision making. So there's something that it's kind of a common acronym in our field, but most of you probably have never heard of it or either of these, but you might hear people talk about AMH or FSH, and these are just two measures, hormonal measures, that again just provide a little bit of an indicator of what your egg quality and quantity may look like at a given age. And sometimes this testing can be covered by insurance. Or even if it's not, typically this type of testing isn't that expensive. So that may be something that you may want to do just to have a little bit of understanding at a younger age of what your outlook might be. So this is a really important thing that we really try to share in every training that we do, which is just to really let people know that infertility is a disease. It is not, thankfully, most often it is not a disease that will kill you. It's not life-threatening, but it's extremely life-limiting. And in our experience, especially emotionally, and again, that's why it's really the cornerstone of our mission to support people emotionally. When you're struggling to grow your family or to conceive, it's something that it seems like so many other people, it comes easy for them and they just seem to take it for granted. And so when you're struggling with that, it really is so difficult and challenging emotionally. So, but it isn't just us saying that infertility is a disease. The World Health Organization, the American Medical Association, many different, this quote is from the American Society for Reproductive Medicine. Many different major international and national health organizations have defined infertility as a disease. And as you may imagine, that has helped us in our advocacy efforts to have insurance cover fertility treatment, because our point to them is that this is a medical need. Again, not to save a life necessarily, but to bring life into the world. And so I think designating infertility as a disease has been an important change, particularly from an advocacy perspective. Also, somewhat, I think, from the perspective of individuals and couples that are struggling, to think of it as you have a disease, I hope helps with not blaming yourself as much as sometimes we do and we're hard on ourselves, is because like typically you wouldn't be like hard on yourself if you had asthma. That would be, it's a challenging experience to have any kind of illness or disease, but it wouldn't be affecting your sense of self as much as sometimes I think infertility does. And it's like, we just need to be kinder and gentler to ourselves sometimes.
Yeah, if I could just add, Kate, I feel like with infertility, I think of it as kind of like the invisible disease. And I think that there are some other diseases that fall into that category, but it's like, you can just, on the outside, you appear a happy couple.
Yeah.
And especially if you already have a child, people are like, oh yeah, I mean, they don't have a problem,
Right.
So it's one of those things. And it's also, it's such it involves such a private piece of your life, right? So you don't necessarily like go and hang out with your friends at the bar and be like, so we're having trouble conceiving, or I hemorrhaged the other day. And, it's just like, and, I'm not saying that cancer is easy to talk about or whatever, but I think that it's almost more accepted and it's not as personal, depending on where you have your cancer or whatever. But infertility can really be kind of that silent suffering. And there's reasons that you don't want to bring it up, especially if you're an introvert, you're a more private person. It's just not something that you want to share with, even, maybe just your very immediate family, and depending on how your family feels about using science to reproduce, or, there's just a lot of opinions, I think, when it comes to reproduction. So it really, all those things kind of compound onto this disease.
Yeah, absolutely. Absolutely. So I think one, common question is, especially kind of early on in people trying to conceive, is, do I have infertility? And I think, so this is just typically, I suggest to people that if you have been trying to conceive for over 12 months, or over 6 months if you're over the age of 35, then it doesn't necessarily mean that you absolutely have problems that are going to require fertility treatment. But I think that is a great time to pursue seeing a specialist, an actual reproductive endocrinologist. So, like, around that time is when I went to my own primary care doctor, which was, actually a really hard conversation to have. I really hadn't kind of said it out loud to anyone other than my husband, to say, like, it really should have, probably something should have happened by now, and nothing has happened. And so I think I remember, like, that being a really hard thing to go to my own doctor and say that, but it put me on a path to parenthood. So I'm glad I did. But it was, and my doctor actually walked in and was like 8 months pregnant. And I was like, are you kidding me? Like, it was poor timing on that part. I was happy for her, but I was like, literally her belly was coming at me while I was trying to tell her that I thought I was infertile. I'm like, oh God. But I really recommend seeing a reproductive endocrinologist, which is a long fancy word for a fertility doctor. A lot of times, like, I mean, I would say if you have a really trusted OBGYN, then I think, and you've been trying for a few months or even several months, that can be a good place to start. But I really think, I wouldn't wait too long to see an actual fertility doctor. They really, truly, they don't rush you into treatment you don't need, but they will give you the specialized testing that you need, and they will really have a good sense of what is, going on. And I think it's another misconception that, like, everyone is going to need IVF. And fortunately, that is absolutely not the case. The vast majority of couples are able to address whatever fertility challenges they're facing with sometimes just medication, sometimes a less advanced type of fertility treatment. So infertility is common. And I think, just as Kirsten said, it's such a private issue in many cases that you just don't know that maybe even in your own circle of friends and family, people have gone through it or are going through it, and you just don't know. So it's thought to impact about 1 in 6 couples. And of course, many other individuals and couples need fertility treatment than just those with infertility to be able to conceive, including LGBTQ people and single people trying to conceive on their own. So the number of people who need fertility treatment or want fertility treatment is even higher than 1 in 6 couples. So anyone who's struggling, a big part of our mission is just to really assure people that they are not alone. And unfortunately, pregnancy loss is also very common. It's thought that 1 in 4 pregnancies ends in loss. And that's such a hard thing. It's common, but very difficult, obviously. It's not that we're taking it lightly in any way. But I think it is challenging that I think a lot of people don't talk about pregnancy loss. And so if you've gone through it, you feel like you're the only one, but of course you're not. It's just that not a lot of people talk about it. And I think when you're pregnant, people don't necessarily want to scare you with the stories of the bad things that sometimes can happen, unfortunately, with a pregnancy. And I understand that, of course, but at the same time, then if a loss does occur, sometimes people are so surprised. They don't feel prepared for the fact that it is possible, because they haven't heard that much about it. So trying to remove the stigma and raise awareness is also part of our mission.
I think with
this is where you're taking it away, I think. That was a good segue. Sorry, I took some of that.
No, that was excellent, Kate. Totally. So yeah, I'm not going to read the slides, but Kate was just talking about pregnancy loss, and just personally having had 4 of them in a row, it is common, right? So 20%, I think that's still the statistic of, and yeah, so 1 in 4, so about 20 to 25% of pregnancies end in loss. So it's common, but it still hurts. It's still hard. You still struggle. So it's like saying, well, car accidents happen all the time, but you'll be fine. There's like almost like a judgment in there where you say it's common. So you should just, don't worry too much about it. Just get back on the horse, which I literally was told by a doctor. Just get back on the horse and try again. Miscarriage, I think there is that myth where, oh yeah, that's just kind of accepted. It can happen. And then, we're just going to try again. So, and I think that some people can do that. Some people can have a miscarriage and it's like, it doesn't just really affect them as much, but then some people, it really derails them. And then especially if they're having multiple or recurrent, that just kind of adds on. So that's the last point too. So there's recurrent pregnancy loss, and there are, this was kind of after my time, but now there are all these tests they can do to kind of figure out why somebody miscarried. If you've miscarried after a certain point, they can actually do tests where they find out, oh, okay, this was a genetic thing or whatever it was. But for most people, pregnancy loss is unexplained. And again, that's just so hard. You want an answer, okay, if I can just know why, then I'll do something different or I'll fix it or whatever. So that can be the feeling that goes along. So I guess, if I were to close this out with anything, it's that if you have a friend or someone who goes through a loss, just listen. You never know where they're at. They could be fine with it and they're just like, oh, it's okay. I just kind of expected this, or, it's okay. But, just, oh, I'm so sorry. How are you doing? That's really just the best response. Just listen.
Yeah. Absolutely. I couldn't agree more with that. With all of this, or with any life challenge, we're always, right? I mean, it's natural. Yes. I think we're fixers. We try to fix it. It's hard to just sit with someone with their pain, but that is the best thing to do, which is just to say, I'm so sorry this has happened to you. I love you. And what can I do to support you? I feel like that can never be wrong. But when we try to give our advice or to lessen, I mean, Kirsten and I and many of our colleagues in this field are on a quest to have the phrase "at least" totally just removed from the English language in most cases, because I don't know if any of you have ever had the experience where you have a challenging life experience and someone says, well, at least you are still breathing. It's like, oh yes, of course. I think it goes without saying that I'm grateful to be breathing, but that doesn't mean that whatever I have experienced isn't extremely challenging. And we find this with pregnancy loss, that people, say, well, at least you're still young, or at least it was early in the pregnancy. And that just minimizes the person's grief, because sometimes, and unfortunately I've experienced loss, is like, even when it's early, it can be so devastating when it was so wanted, and when you begin to dream and hope about this life. So anyway, so I absolutely so agree with that.
So yes, and then this, we've been touching on this, I feel like, all along. So the emotional impact of infertility and kind of the silent struggle. There has been some research done. There's a place in Waltham called the Domar Center for Mind Body. Did I say that right?
Yeah.
Right, the Domar Center, yeah. And so they've done some research, and they found that the emotional toll of infertility can be similar to the emotional toll of cancer, heart disease, other diseases. So, and it makes sense, it really does. I mean, reproduction, if that's what you choose in life, it is such a basic human desire. Not for everybody, but it definitely just, you might, when you couple with someone, or if you want to build a family, you might think, oh gosh, I don't know, how are we going to afford a house, or how are we going to how are the two families going to get along, or you kind of think about those things. But I don't think a lot of people think, are we going to struggle to build a family? You just think, oh, we found each other, this is amazing. Or, I know I want to be a mom or a dad. And, in this day and age, there's so many ways to do that, whether you're on your own or you're with someone. So I think that this is something that, again, it just really blindsides people. And it can happen when you're so young, it doesn't discriminate. And then, of course, the length of time that you're dealing with infertility can just really make things even more difficult. And that can be a tough thing too, is deciding when to stop treatment. So it really is in your hands to a small extent about, are we going to continue down this road? It's been so hard. Are we going to continue with this? Or are we going to stop, or maybe just take a break? So, and that can be a really hard decision, because you think, well, maybe tomorrow something will happen and change and it will work. So that can be a very difficult decision along this journey as well. And, Kate was talking about how we have support groups on several topics. And one group that we have that is just really popular right now is So Expecting After Infertility. And as you can imagine, when you've dealt with loss, when you've gone through so much to finally be expecting, whether you're pregnant with a child, whether you're adopting, whether you have a surrogate, whatever it is, it's triggering. So it kind of triggers these things that have happened along your journey. So once you have a child, it doesn't just stop. You're not just cleaning your slate of infertility. You can kind of be triggered where, for instance, someone who's gone through years of infertility and they go through the toddler years, you can have guilt that you're like, oh God, I just need a break from this kid, or this kid is driving me nuts, or God, I didn't know it was going to be this hard. And you have guilt because you're like, oh God, I should be so grateful. So we, Resolve New England continues to support people once they have started to build their family, or even when they are resolved, they feel their family is complete. We continue to support them as parents. We feel that's important.
Absolutely. Oh, my slides aren't advancing for some reason. Uh-uh.
I feel like this always happens.
I know.
Like they
Oh, there we
advance
go.
just fine. Oh, here we go.
Okay, that was weird. Yeah, it advanced fine all night. So just a reminder, definitely put any questions you have in the chat. We're happy to answer them like as we go along or at the end or whatever. And really, we are, as you can probably tell, an open book. So there's really nothing pretty much you can't ask us. And we truly want to help. I don't think we have anything in the slides, for example, about egg freezing, but if anyone has any questions about that, again, we're not clinicians, but we're happy to talk about that if it would be helpful. So here, we just wanted to give you a little bit of the basics of some of the more common parts of assisted reproductive technology, which is kind of an umbrella term for fertility treatment. And IUI, again, there's kind of an alphabet soup. So you hear a lot of initials within the fertility community. And I know I see sometimes people that are new to even the various, which is great that they exist, infertility groups on social media. And you see people being like, oh, like, what do these acronyms mean? And I feel so bad. And like, truly, some websites have created like a directory to all the, shorthand, and I'm like, thank God they have, because it is a little overwhelming at first. But so here are just a few of the terms related to treatment that you might hear or see. So intrauterine insemination is often kind of maybe not the first thing that will be tried when you're having fertility challenges, but it's a less invasive procedure for sure than IVF. So basically, the sperm is put inside the woman's uterus. It's physically very similar to having a pap smear, basically. So you're not under anesthesia or anything like that. It's done in the office, and then you rest for a short time and then you go on with your day. It seems kind of a little bit crazy considering how important it is, but physically it is not very invasive. But IVF, which most people have heard of, is in vitro fertilization, and that's the process where the egg and sperm are combined outside of the body in the lab. And so the eggs are removed from the woman's ovaries in a more of a surgical procedure where they actually are typically under anesthesia, and then they're mixed with the sperm and fertilized in the lab. And then the result is an embryo that is transferred back to the uterus with the hope that it will be successful and that they will conceive. And ICSI is a specific type of IVF procedure where a single sperm cell is injected directly into the cytoplasm of an egg. And that is often done if the male has fertility challenges, because it's just a more exact way of trying to make the IVF procedure as successful as possible. So that is our very brief overview of from your non-clinicians here, but especially, like I said, it's just when I feel like you hear the initials, I wanted people to understand what was what. So again, happy to answer questions about that. So we, as an organization and us individually, we of course do a lot of supporting and informing people about fertility treatment, but there are fortunately so many ways nowadays to become parents, and they also come with their own wonderful things and challenging things about them. So that's a big part of what we do, is just, again, try to make sure people are nurtured and informed and empowered on all of those paths. So that includes using donor egg, donor sperm, using surrogacy, or doing adoption, either private adoption, foster adoption, international adoption. So we really focus on all of these in terms of helping people find their way. And again, we're happy to answer any questions that you might have about any of those paths. And
Kate, I might add to that list,
sure.
only because we've been getting, just more and more interest in it, is donor embryo.
Yes, yeah.
So
That's
yeah,
true.
so as you all, I'm sure are aware, so people going through IVF, going through this process, they can end up with a surplus of embryos, and those are frozen, and then let's say that you feel your family is complete, and then you have these other embryos that are frozen. So it's called embryo donation. You can donate them to science. You can donate them to another couple. And there are several organizations now that kind of work as like networking matching services. So kind of matching these couples that have this surplus of embryos and want to donate them, and then these people who called intended parents who are looking to be matched. So, and it's can be like adoption, where the parents who are donating, they can choose. Some organizations allow them to choose the families that they donate to. So it's nice. Again, there are options there, which is nice, but we're definitely getting more interest in hearing more buzz about donor embryo.
That's so true. I mean, even in the year since we presented this last,
Yeah,
donor embryo has become so much more a question that we get. So it really should be on this slide for sure. And we will be talking about it a little bit at our conference too, because of that, because of hearing those questions more often. All right, so just I think one last thing, we just wanted you to know there are a lot of resources out there to help you if you are struggling, or if you have loved ones who are struggling, friends or family. Um, we didn't talk about that in too much. Well, I think Kirsten's advice was the best one going, which is just to really focus on listening and supporting. One thing that can be really challenging is if you have a loved one that you know is going through infertility and then you conceive. It can be really hard to navigate that. And my personal advice is just to if you know, like your really good friend is struggling with infertility and then you conceive, I really suggest like writing to that person privately, to let them know so that they can deal with the news in their own way. And then hopefully you can get together and celebrate it together, but it gives your friend that chance to kind of deal with it on their own. And I know sometimes that feels impersonal and you feel like you want to go out to dinner to tell them, or you want to tell them talking on the phone or something. But in this case, I think the giving them the space and time to deal with your news, because it is bittersweet. I mean, they will be very happy for you, but it's hard for them too. They're trying so hard to have that happen for themselves. So it can be really hard. So that's just one example. But anyway, we, of course, as you can tell, we are here to help you. Resolve New England. I also mentioned that there's a national Resolve organization. And particularly, again, if you have friends and family outside of New England, one of the things I love the most about Resolve's website, National Resolve, is you can plug in your town or your zip code, and then it shares with you what the support groups are that are closest to you. So that's really helpful. And then there is a National Infertility Awareness Week every April, and there's a website just for us, just for that, which is, I think, really great. And so that website is infertilityawareness.org. Reproductivefacts.org is the website of the American Society for Reproductive Medicine, but there's a part of that site that's specifically for individuals and couples. So there's a more complex part that's where the physicians and clinicians share really technical information, and then there's a part of the website that's really in a more common language that all of us can understand. And then there's actually a lot of new organizations around fertility information and support that have started in the past couple of years, which I think is wonderful. Again, obviously we're a nonprofit, so we're not worried about having more competition. We want there to be as many resources out there as possible so that people find the one that resonates the most with them. So one that I love is called cofertility.com. The co stands for like compassion, community, and connectedness, something like that. It's not Colorado. It's the co is in for all these different attributes of the organization. But the founder of that actually lives in Massachusetts. She went through infertility, and I love her website is very fresh and young, and you guys, I think, would really love it. Here's all the places to find us on social media. We would love to be connected with you on social media. And actually this weekend, again, I'm not worried about competing. We would love to have anyone who's interested attend our conference, and we shared that link earlier. But also this weekend, there's actually 2 different virtual fertility conferences. One is Saturday and Sunday, and it's run by a wonderful organization called the Endometriosis Summit. If people have any questions about endometriosis, again, I'm not a clinician, but I'm glad to try to answer them. But that is a fertility conference sponsored by the Endometriosis Summit. And there's another organization called Fertility Tribe, and they have a really cool virtual conference happening this Saturday as well. Some really great speakers for that one. So I guess one silver lining of this very challenging year is just there's a lot of content out there for us to spend some of our time at home learning in the comfort of our own PJs in some cases. So I think that was it for our presentation, but of course we're happy to answer any questions.
So there was a couple questions. Someone said, back to the playground example, what question would you recommend asking a parent too conceited about fertility / losses? Just avoid numbers altogether?
That's a great question. Yeah, to your point, Kirsten, that when you meet a parent with one child, you never say like, oh, you only have one, or when are you going to give her a sibling, or that kind of thing.
Yes.
Yeah.
Yes. Is that the question? Was that?
I think what should you say, I think was the question.
Oh, what
like
should you say?
if you don't say something like that, what should you say?
Well, I mean, I don't know if this is what you should say, but like something that I came up with, because I literally, I just, I don't know. And these, what's so funny is that I just assumed that every parent that had one child was upset about that. So like, like there are plenty of people, and I have best friends who are like, nope, one, done, good.
Right.
But one thing that I did say, and I mean, I would love your reactions when I would meet someone with a child, I would just be like, I would look at the girl or the boy and I would be like, oh my God, you're so lucky you get mom and dad all to yourself. What a lucky girl, what a lucky guy, or yeah, I mean, maybe just not saying anything, right?
Yeah.
Just not drawing attention to it is probably another great, but I think, again, it's not that people are, of course, they're not trying to hurt somebody's feelings or be that way. I think they just are trying to fill space. And, it's, yeah, I think maybe just not saying anything, striking up a conversation about something else, or, yeah.
Yeah.
What do you think, Kate?
Yeah, I agree.
Okay, and then a couple more questions. Is miscarriage generally considered infertility, even though technically there was a fertile time at the beginning?
That is such a great question. And actually, we don't even really use the word miscarriage as much anymore. I mean, that's a very familiar term, obviously, that people use. And we use it occasionally because we want people to know what we're talking about. But we say pregnancy loss more often because we find the actual word miscarriage seems like, again, it adds to, even subconsciously adds to this feeling like you carried wrong and you did something wrong. And really that is not the case. It's one of the, I think the hardest things about it is that, as Kirsten said, you often don't know why it's happened, but the one thing we usually know is that it was nothing that you did or could have prevented. It's really a mysterious, really difficult thing. So I just want to say that. But I'm so glad you asked that, because we absolutely consider anyone who is struggling to grow their family part of our community. So we can only speak for Resolve New England, but I know this is true of the fertility community in general, is that it may not be a struggle to conceive. As Kirsten said, she did not, unfortunately, she did not have trouble conceiving. She had trouble healthy all the way to a healthy live birth and experience loss. And so to us, it isn't just the struggle to conceive, it's the struggle to really reach that goal of the family that you want and growing your family. And even if you are blessed to have one child or one baby and you want another and you're struggling along the path of that, we consider you part of our community. So that from a broad perspective, we consider, and that's why we've really tried to broaden our language. We actually don't talk as much about infertility, although again, that's obviously a huge part of our mission. But we talk about family building struggles and fertility struggles because that is broader than just struggling to conceive. It's struggling to have the family that you wanted to have. And from an insurance perspective, in the past, actually, Massachusetts law, fertility insurance law, was passed in 1987. So of course it needs updating. It's, when over 3 decades have passed, inevitably things need to be updated. And one thing that was updated, I guess now 10 years ago, which is crazy, was that a pregnancy, so basically, if you conceived but lost the pregnancy, it wouldn't kind of restart the clock on that 6 to 12 month time frame of you trying without success to be deemed infertile. That is considered still part of the experience of trying. So I hope that makes sense. Basically, you're not disadvantaged by having your loss, thank God. That on top of all the grief that you have, if it also meant from an insurance perspective that you kind of had to start over trying, that was really hard. So the law was changed 10 years ago so that you're not disadvantaged from an insurance perspective of having pregnancy loss.
Yeah, Kate, that brings up you bring up such a good point about just the word infertility, because the disease of infertility is 2 parts. So the inability to conceive is the first part. That might be what you struggle with. But then the other part is the inability to carry to term. So it's confusing, right? Because like you said, you can have infertility and you're conceiving all the time, but you're losing. So it's old, outdated language. Yeah, for sure.
So I hope that helps.
Yeah.
And then someone asked, if someone was interested in egg freezing, do you have any resources you'd recommend?
Yes. I can't think of them offhand. Maybe you can, Kirsten, but there are some kind of and actually some of the ones that I shared before might be a good source for that. I really recommend finding independent resources that explain about egg freezing. I mean, no disrespect to our partners that are fertility clinics, because we are very fortunate in New England. We have some wonderful fertility clinics and they are great partners of ours and they are excellent. But I really think it's good to find independent information about that. It's hard, clinics want you to have good information, but at the end of the day, they're in the business of potentially doing the egg freezing for you. So it's hard for them to be truly, truly impartial. And again, I mean, no disrespect to them. But I think finding that reproductivefacts.org is the ASRM website. I think they would have really good impartial statistics about egg freezing. But I think egg freezing, what's sometimes called elective egg freezing, which means you're not doing it for a medical reason, like a diagnosis of a disease or a treatment for a disease that's going to potentially impair your fertility, but elective egg freezing, where you're choosing to freeze your eggs for future use, is something that can be, again, really empowering, because if you are not necessarily in the point of your life or your career where you want to build your family now, but you can preserve those, for lack of a better word, your young eggs at an earlier age, it can be really a powerful thing to do. But it can be really expensive. Most insurance doesn't cover it. Some employers do, but most insurers don't cover it. So you would be paying out of pocket for it. And it can be, a little bit physically demanding as well. So I want people to know both sides, but I also think, it can be really empowering if you can do it.
Okay, and one more question we got was what you kind of touched on a little bit, but Could you touch more on the Massachusetts healthcare laws? For example, my employer claims to cover infertility, but the coverage is unclear, especially for a single person who is not sure if they have upcoming challenges.
Yes, yes. I unfortunately, this is a challenge. Like I said, there's only 19 states that have a fertility insurance law, but even in the ones that have one, there's a lot of inconsistency in what's covered, including Massachusetts. I would say, generally speaking, Massachusetts is pretty generous and broad coverage in general. But even with that, there's a federal law that ensures that any employer that is what's called self-insured, which means they control the health plan that their employees have, they are not governed by a health mandate in their state, any health mandate in their state. They can make their own decisions around what is covered. So even in, like I mentioned, the 4 New England states that have infertility insurance, sometimes employees will unfortunately realize they work for one of those self-insured employers, and thus they don't have coverage that they thought they would have because they live in a mandated state. So that's always really hard when people realize that. But it sounds like from your question, you do have some kind of fertility coverage within your employer's plan, which is good, but it sounds like it's hard to figure out exactly what it covers. And unfortunately, as a single person, you probably will be very disadvantaged in what will be covered, which is so unfortunate. And again, is something that we are going to be trying to advocate to update. The bill in the law in Massachusetts is just so old that it really, I mean, it's so appropriate to raise given the mission of your organization, but it's the language of the law is very focused on the female, which is, of course, so inadequate because, as we know, fertility challenges are male and female, sometimes both. And it also really emphasizes a couple, a heterosexual couple trying to conceive without success. And so both of those things really disadvantage a single person or an LGBTQ person trying to conceive on their own and trying to access coverage. So it's hard to say your specific case, but I would say, you know, the best you can, try to get the most information from your actual insurer about your plan because they do vary so widely from plan to plan. Um, but sometimes you can get coverage potentially, even if you were trying to conceive on your own, if you had, say, an underlying condition like endometriosis or something like that, you could then make the case that you do have a clinical diagnosis, even if you don't have a partner, even if you were, say, using donor sperm.
And that was all the questions we had come in so far, unless anyone has some last minute questions.
Well, it was so great to be with you all. And like we said, we loved being there on Newbury Street with you last October, but this is really nice to be with you tonight. And I hope you really heard from both of us that if you are struggling with this, or if you have a loved one who is struggling with this, we really are here for you. That is our, you know, we're always sorry when we have this in common with anyone, but the thing that we do want to make sure is that you know you have people to lean on that are right here in New England. And so you have us, like the commercial says. And our motto is find your people, which is kind of a good model for the junior league too. You all find each other for the great work and community service that you do together. And for us, we say find your people because we feel you have to find those people who really understand what you're struggling with and can provide you with the support you need. So we have a lot of great resources that we know of in the area. So feel free to reach out and let us know what you're looking for, and we can usually connect you to a person or an organization tailored to your needs.